Hello dear students. So in this session I'll take radiology. The very first thing is X-rays, which were discovered by William Conrad Roentgen, and the basic principle of X-ray includes a cathode and a anode. So from the cathode side there is generation of fast moving electrons and it moves towards the anode side, and on anode there is one target material where these fast moving electrons they hit, right? So when these fast moving electrons, like if this is cathode, this is anode, on anode there is a target material, clear? So this is the target, this is anode, this is cathode. So from cathode there is generation of fast moving electrons which goes and strikes the target material. When these fast moving electrons strikes the target material, they are converted into X-rays, right? Then these are converted into X-rays. So there is a target material and this target material is made up of tungsten. Then there is one term, that is grid, which is to be placed between the cassette, right? So this is, you can say, X-ray film cassette, and this is the patient here, you can say. So patient or the subject, and this grid is placed somewhere here, right? So the purpose of grid is to avoid scattering of radiation, clear? So this is the importance of this grid, which is placed between the subject and the X-ray film, right? So it makes sure that there is less scattering of the radiation or the X-rays, clear? So this is grid. Then the contrast in X-ray, it depends on kilovolt peak, and here the relationship is inverse. It means if there is low kVp, it means contrast will be high. So contrast, it depends on kilovolts peak. Then there are certain terms. One is atomic number, and this number is actually the number of protons. So suppose this is one proton, this is another proton, so the atomic number will come out to be 2. So this is the atomic number, that is number of protons. Then another term is atomic weight, which is the sum of protons plus neutrons. So if we add the neutrons as well, so these are the neutrons here, first and second. So the atomic weight comes out to be 4, that is 2 protons plus 2 neutrons. So atomic weight is protons plus neutrons, and atomic number is only the number of protons. Now there is one term, isotope. In isotopes, the atomic number is same in different isotopes of a given substance. So suppose if there are 2 isotopes of a given substance, so atomic number will be, say, 2 for both. So atomic number is same in both, but the atomic mass or the atomic weight will be different. Say here it can be 4, here it can be 5. So in isotopes, atomic number is same but atomic weight is different, and because the number of neutrons differ, Clear? So in different isotopes, the number of neutrons differ, number of protons remains the same, which is equal to atomic number. So this is the concept of isotopes. Now what if reverse, like same atomic weight and different atomic number? Then it is known as isobars. So in isobars of a given substance, again we can take the example A and B. So atomic number and atomic mass or atomic weight. So here atomic mass will be same, say 5 for both, but atomic number will be different. So 2 here, say 3 here. And this means the atomic mass is same here, and the atomic number, that is the number of protons, is different. Clear? So this is how the concept of isotopes and isobars can be understood, right? So this is isotopes and isobars. Then gamma rays can be produced from cesium 137, cobalt or radium. And if we talk about the penetrating power of different rays, then you can see here neurons have got the maximum penetrating power, followed by gamma rays, followed by medical X-rays, followed by beta, and the least penetrating is alpha. So you can remember this sequence if there is a question about penetrating power of rays. So neutrons followed by gamma rays. Now we can see here the alpha has got the least penetrating power, but alpha are the most ionizing rays. So least penetrating power but most ionizing. Now the another investigation is mammography. Now mammo means breast. So we are actually imaging the usually we do it for female breast. Now here you need to remember one thing, the age group when we need to do mammography. It is usually advised to do it after 40 to 45 years. Should not be done in young lady, right? So should not be done in a young lady. There are a couple of reasons for that. Number one, the breast is dense. Clear? So the image is not properly visualized. And second, this mammography has high radiation exposure, and we don't want to expose a undiagnosed pregnancy to mammographic radiations, right? So these are two reasons why we avoid doing it in a young lady, always reserved for older ladies. Now there are two views. One is craniocaudal. Clear? So this is craniocaudal, and second is mediolateral oblique. Clear? So MLO and CC. Craniocaudal and then mediolateral oblique, right? So these are the two views in mammography. Then moving to ultrasound, the frequency which is commonly used in clinical practice is 2 to 20 megahertz. Now there is a transducer through which the sound waves, they go inside the body, and then it creates image which is perceived by this transducer. The crystal is lead zirconate titanate. And the good thing is it is an non-ionizing investigation and there is no radiation exposure. So it can be done freely in pregnancy. So can be done freely in pregnancy because there is no radiation exposure to the developing fetus. One of the variant of USG is Doppler USG, which is usually done for evaluation of blood or what we call moving fluid, right? So this is, you can say, moving fluid, right? Another non-ionizing is MRI. I think most of you must be knowing that. Now coming to magnetic resonance imaging, the most commonly used contrast agent is gadolinium DTPA. But there are certain contraindications to MRI. In such patients, MRI should not be done. Of course, one is cardiac pacemaker. Especially in cases of bundle branch block, we need to put cardiac pacemaker. So, in such cases, don't do MRI. Then, cochlear implant. So, in cochlear implants, don't do MRI. Then prosthetic heart valves, don't do MRI. So these are some important contraindications where MRI should not be done, or aneurysmal clips. Now there is one term which is associated with MRI and that is Faraday's cage. Now this MRI works on the principle of magnetic resonance, and it might be possible that nearer to that MRI center there might be some radio stations or TV stations. Those will be, reflecting some electromagnetic radiations. So those radiations, they can hamper with, or they can interfere with this MRI signals. So for that, what we need to do, we have to put a shield of copper in the MRI room so that there is no external influence. So Faraday's cage is actually continuous sheets of copper that blocks out radio frequency signal that might come from a radio or TV station. Otherwise, it will influence the MRI studies. So this is the Faraday's cage and it is using copper as an insulator. Clear? Now moving forward to CT scan. Now CT scan is much more improved version of, you can say, X-ray, but at the cost of radiation. So radiation exposure is much more. Clear? So radiation exposure is much more than X-ray. This is invented by Hounsfield, and there is one CT number or Hounsfield unit, and this actually depends on the mass density, and you need not remember the values for everything, just remember for two. One is water, which has got a 0, and the another one is bone, which has got maximum. Clear? So this is, and of course even more minimum is air. So these are few substances for which you can remember CT number or Hounsfield unit, which depends on mass density. Now CT scan rooms are also shielded by LEDs, right? So CT scan rooms are also shielded by LED. Then there are some important questions which are about CT images, and one is the subdural hemorrhage. So you can see a classical concavo convex deformity. Many students, they remember it as banana shaped opacity. Clear? So this is subdural hemorrhage, or also known as the crescentic hyperdense lesion. Then medulloblastoma can show lentiginous appearance on brain CT. And another one which is very important is extradural hemorrhage, which shows biconvex. Clear? So biconvex means something like this, and student, they remember it like lemon shape. So these are two important questions which are repeated over the years, and one should be very perfect with this much at least. Then another investigation is positron emission tomography or PET scan. Now in PET scan we use FDG, that is 2-fluoro 2-deoxy glucose, FDG, right? And then PET scan, it can be used for differentiating radiation necrosis from active neoplasm, or most importantly, it is the investigation of choice for recurrent gastrointestinal stromal tumor. So gastrostromal intestinal tumor. Clear? Then myelography. Right? Here what we do lumbar puncture, and then we inject the contrast agent, which is usually iohexol. So, and post lumbar puncture, the contrast is injected into subarachnoid space. Clear? So this is in subarachnoid space, and then we can take the imaging. Now here the commonest complication is headache, and the severe complication is inflammation, that is arachnoiditis. Clear? So arachnoiditis. Then moving to region wise anatomy, starting with cardiovascular system. Now right border of heart, it is formed by three structures: superior vena cava, downward inferior vena cava, and in the middle right atrium. So this is how the right side heart border is formed on X-ray. So superior vena cava, inferior vena cava, and right atrium. On left side there are four structures: arch of aorta, pulmonary trunk, left atrial appendage, and finally the left ventricle. So left atrial appendage, left ventricle, aortic arch, and pulmonary trunk. And here one should remember this is left atrial appendage and not left atrium. Clear? So what I mean to say is that left atrium normally does not create its shadow on X-ray. Clear? So normally we don't see impression of left atrium on X-ray. It's only in mitral stenosis, when it enlarges, it will create its impression, and that is known as double atrial shadow. Now we will take some conditions. For tetralogy of Fallot, please remember boot shaped heart, and it is quite easy to identify. Clear? Something like this. So this is a typical boot shaped heart, right? So just remember that. Then for transposition of great arteries, you can take the impression as a egg. Clear? So it is something like an egg on a string at times. Clear? So it can be taken as an egg on a string. Then the easiest of all is total anomalous pulmonary venous connection, and here we can see a figure of 8 or a snowman's heart. So very easy to remember, but the thing which you should remember that it is especially the supracardiac variety of TAPVC. So just remember the complete term. Then in mitral stenosis, I already told you that there is double shadow, or you can say double atrial shadow, because normally what we see is that there is a impression of only the right atrium as it forms the right border of the heart, but in this case there is impression of left atrium as well, because left atrium enlarges in mitral stenosis. But in mitral stenosis, the earliest radiological feature is straightening of left border of heart. Clear? So left border of heart. There comes a straight line, something like this. So that is known as straightening of left border of heart. Then hydrated cyst, it will show water lily sign. Then heart failure. And one, before we go into this, there is one CT ratio, right? So what we do, we on an X-ray, we take the measurement of heart. So suppose call it C, and we take the entire extent of the thoracic, right? So heart and thorax, and so this is cardio, right? And this is thoracic. In a normal person, this should be less than 5, or you can say less than 50%. But what happens if there is heart failure? Obviously, the heart dimension will increase. So here, if you take the CT ratio, it may go beyond 60%, and this is what is known as cardiomegaly, right? So megaly means enlargement. In simpler words, megaly means enlargement. And if the heart will enlarge, obviously the value of C will increase, and therefore the ratio will increase. Then there is prominent upper lobe veins, but more importantly, at the bases of lungs, you will see these horizontal lines. Clear? So these are present at the base of the lung field, and therefore from the base we are taking the word B. So these are known as curly B lines, right? So curly B lines are the horizontal lines at the base of lung field, and they represent pulmonary edema, and that is secondary to left ventricular failure. Clear? So not that difficult. Then moving to respiratory system. Now here we can see very fine bilateral dots. Clear? So you can see very small white dots everywhere. Now this is a classical X-ray of miliary tuberculosis. It means the tubercle bacilli has spread hematogenously to both sides of the lungs, and this is known as miliary tuberculosis, right? So this is miliary mottling. So just at least remember one condition, tuberculosis. Then in ARDS, or what is also known as hyaline membrane disease, we will see ground glass opacity. So this is ground glass opacity. Clear? This on the left side is normal, but here you can see opacity. So ground glass opacity. in pneumonia we will find, in pneumonia there is consolidation. Clear? And in consolidation we will find opacity, and that will involve the entire lobe of the lung. Now the basic difference between consolidation and ground glass opacity is that the opacity here obscures the vascular impression. Clear? So we cannot see the vascular marking. But in ground glass opacity will be there, but no obscuring of vascular markings. So this is the basic difference between ground glass opacity and consolidation. And for ground glass opacity, you please remember the example ARDS, and for consolidation please remember pneumonia. So just one example for both are enough, right? So this is very important. So ground glass opacity can be remembered here, and this is consolidation, and it will affect an entire lobe. And pneumocystis will also show ground glass opacity. Then the curly B lines we have already discussed. You will see horizontal lines something like this. Clear? So you will see horizontal lines something like this. So these are curly lines, curly B lines, and remember the word B with basal zone, and again a feature of pulmonary edema, which is secondary to left ventricular failure, right? Then moving forward to pulmonary embolism, and a very important sign is Hampton's hump. So here you can see a wedge-shaped opacity. So this is the Hampton's hump. Clear? So the moment you see the word Hampton's hump, think of pulmonary embolism. There are two more signs. One is the Westermarck sign, and another is the Palla sign. So remember these three signs for pulmonary embolism. Clear? Chalo. Then for bronchiectasis, we can do a high resolution CT scan, that is HRCT, and you can classically see the signet ring appearance here. So this is the signet ring appearance. It's very easy to identify on CT scan. So you can classically see here something like this, and then something like this. So this is the signet ring appearance. Then benign pulmonary hamartoma, it gives a classical popcorn-like appearance. So this is pulmonary hamartoma, and it gives a popcorn-like appearance. In GIT, if you see only one gas or air shadow, okay, this is only one air shadow, so this is a single bubble. Clear? And this is suggestive of, this is actually in stomach, so it means somewhere here there is obstruction, and this is known as pyloric stenosis. Fine. So single bubble, please remember pyloric stenosis, the air is only in stomach. Now in double bubble, you can see this is stomach air, and this is the duodenal air. So we can see two air impressions. Clear? One of the stomach, and secondly of the proximal duodenum, and usually this is D1. So this is known as double bubble sign, and this is because of obstruction somewhere here. And here it can be by two conditions: either there is duodenal atresia, or there is a rim of pancreatic tissue which is surrounding the second part of duodenum, and that is known as annular pancreas. So suppose if this is the second part of duodenum, it is surrounded by a rim of pancreatic tissue, something like this, and therefore it is compressing it. So this is the duodenal, this is the pancreatic ring, right? So this is the pancreatic ring, and inside is the duodenum. So this condition is annular pancreas. Annular means surrounding from all side like a ring. Then widening of duodenal C loop. See, this is the duodenum like this, and this is, here is the head of pancreas. Clear? Something like this. So whenever there is tumor here, it will definitely push upon the duodenal C loop, and it will cause widening of the duodenal C loop, right? So this is carcinoma, head of pancreas. Then chain of flake appearance, it can be seen in chronic pancreatitis. Bird of prey sign can be seen in sigmoid volvulus, and ischemic colitis will show thumb printing sign. So here we can see the thumb printing sign. Clear? So thumb printing sign on ischemic colitis. Then this is flower vase appearance, and this is suggestive of the condition where the lower poles of the kidney, they unite, and that is known as horseshoe kidney. Clear? So this union of the lower pole, it occurs somewhere in front of L4 vertebra. Fine. So this is horseshoe kidney. Then dropping lily or dropping flower sign, it is ectopic ureter, or you can say duplication of ureter. Cobra head or adder head, it has to be remembered for ureterocele. Okay, so ureterocele. Fine. Then rim sign for hydronephrosis, and there is one spider leg sign which is seen in polycystic kidney disease. Clear? Then related to TB bladder, there are two terms which you should remember. One is gallful ureter, and second is thimble bladder. So this is gallful ureter and thimble bladder, and this is polycystic kidney showing spider leg pattern. Then in vertebral hemangioma, we can see two signs. If we look from lateral side, we will see linear striations, and if we take a transverse section, we will see polka dot. Clear? So this is for vertebral hemangioma. In achondroplasia, we will see champagne glass pelvis. So somewhat like this. So champagne glass pelvis. Okay. Then pencil thin cortex will be seen in scurvy. Apart from that, we will also see white line of Frankel. Then we will see Palcan spur, and we will also see Trummerfeld zones. So these are some other points related to scurvy. If you see onion peel appearance, especially in diaphysis, right? So diaphysis, or what you call shaft, then answer has to be Ewing sarcoma. In a cyst, if you see a piece of cortex which is lying at the floor, this is known as fallen fragment sign or fallen leaf sign, and this is suggestive of a simple or unicameral bone cyst, right? So this is affecting the proximal humerus, and the size of cyst is less than the size of the growth plate. Clear? So this is important feature here. The size of the cyst is shorter than the size of the growth plate. Fine. Now, for osteosarcoma, one important sign is Codman's triangle. Clear? So this is the Codman's triangle, and please be noted that this is a non-specific sign. Codman's triangle, it can be seen in some other conditions as well, but yes, for exam purpose, it can be taken for osteosarcoma. And another important sign is the sunray appearance. Clear? So the other important sign is the sunray appearance, which is calcification along the blood vessels or Sharpie's fiber. Clear? So Codman's triangle and sunray appearance. Ground glass appearance or cotton wool appearance, it is seen in fibrous dysplasia, but more importantly, you should also remember Shepherd's crook deformity of proximal femur. Clear? In osteomyelitis, the earliest radiological find is soft tissue swelling, but again it is of no use in making our diagnosis. And diagnosis is always clinical based on symptoms. Waters view, which is also known as occipitomental. Now mentum means chin, and occipit, I think everyone knows. So this occipitomental view is also known as Waters view, and this is specially done for visualizing the maxillary sinus. So this is the maxillary sinus here, right? This one. So this actually helps us in studying the maxillary sinus. But sometimes if we tell the patient to open the view, we can see sphenoid sinus also. So sphenoid sinus only if an open mouth view is taken. Clear? So this is the Waters view or the occipitomental view. Then there is one odontoid view, and this is especially done to visualize the odontoid process of second cervical vertebra, that is axis. Clear? So especially the odontoid process of C2 vertebra. Then for subarachnoid hemorrhage, the best investigation is non-contrast CT. Intracranial calcifications can be seen in neurocysticercosis, which is a parasitic condition because of Tinea solium. Then suprasellar calcification, it can be seen in craniopharyngioma. Now supra means above, sellar is sella turcica, and in sella turcica there is pituitary gland, right? So just above that, this is craniopharyngioma, which can also present with calcification. So for calcification, you can remember two entities, neurocysticercosis and craniopharyngioma. In Sturge-Weber syndrome, we can see railroad or tram track calcification. Now tram track or railroad is something like this. Clear? So you can see something like this. Fine. So railroad or tram track calcification. Then in children's, if there is raised intracranial tension, it will open up the sutures. So that is known as sutural diastasis. Because in children they are not that hardly or firmly fixed. Now in adults, this sign is not seen. Clear? Because the sutures are already very strong. So what will happen here? There is erosion of sella turcica. Clear? So the X-ray views are different in different age group. For raised intracranial tension or intracranial pressure. Then background radiation is present everywhere, but it is usually not harmful, and in medical facilities the exposure should not go beyond 5 rad per year. Then measures of radiation for absorbed dose, you can remember, you can write it like radiation absorbed dose. So here you can take RAD. So this is very easy to remember, rad, but this is the traditional unit. The SI unit is gray. Clear? So rad, gray, rad, you can remember like that. Then for equivalent dose or effective dose, it is same. RAM is traditional and sievert is the SI unit. And for exposure, the old traditional unit was Roentgen and the SI unit is Coulomb per kg. So you have to memorize this chart. You can make your own mnemonics. Clear? Then radiotherapy is of two types. One is teletherapy, which is from distance, and second is brachytherapy, where the radiation source is placed close to the tumor for radiotherapy. Now here we can see interstitial brachytherapy, and of course this is done for carcinoma breast. So this is just one way of brachytherapy. Sometimes we can put in vagina also, so that is intracavitary brachytherapy. Clear? Then you can memorize half-life of some important like cobalt, which is around 5.2 years. Then iodine you can take as 8 days. Fine. Then radium 1600 years. So you can just memorize half-lives of certain important radioactive nuclides. Now different radionuclides or radioactive substances are used for different investigations. Like for parathyroid we can use sestamib scan. For renal GFR we can use DTPA. And for studying renal morphology we can use technetium 99 DMSA, right? So for GFR, which is, you can say this is physiology or functioning, and this is morphology, so you can say anatomy. Clear? So how to remember? Remember M of morphology with M of DMSA. Clear? So DMSA, DTPA, technetium 99. For thyroid scan, we can use iodine 131, although we have option of 123 also. And iodine 123 is used for radioactive iodine uptake. Then radiosensitivity of tissues. The most radiosensitive cells are lymphocytes, cell structure is DNA, cell cycle phase is G to M, and radiosensitive brain tumor is medulloblastoma, radiosensitive bony tumor you can remember as Ewing sarcoma, right? So this is Ewing's. Cartilage is radio resistant. Then radiation syndromes, if we give radiotherapy, most common manifestation is erythema. You can see the redness here. Then there are certain tumors which can develop because of radiation exposure. One is the papillary carcinoma of thyroid. Then some drugs, they will increase the sensitivity of the body to radiation, and some will decrease the sensitivity or they will protect. So one is amifostine, which is radioprotective. It will protect the body from harmful effects of radiation. On the other hand, hydroxyurea or 5-fluorouracil, these are radiosensitizers, mean they will increase the side effect of radiations over the body, right? So this is all about radiology. I'm very sure you must have enjoyed the session. So very shortly I'll come back with another subject. Till then, keep on studying. God bless. Bye bye.